Great. Good morning. It's nice to be here. I feel like I'm among friends. I know half of you. And as Joe said, I know how sophisticated many of you are in your work and your thinking about the relationship between the private sector and society. So I'm hoping these comments can build on what you already know to be true or what you're experiencing in your own work. So as Joe mentioned, we're going to try to cover shared value and collective impact. Frankly, two typically separate keynote addresses in one time, because there is a very unique and appropriate relationship between the two, especially as we think about corporations. And if you keep this quick paradigm in your head as we go through the next 45 minutes, shared value represents kind of the what. What companies ought to be thinking about in terms of their relationship to society. Collective impact then relates to kind of the how. So shared value is what do we do? Collective impact is kind of how we do it. We do it in collaboration with many others because, and we'll get to this, many of these issues are so terribly complex. I do want to talk about a quick story before we jump into this. For how many of you are familiar with kind of tromping around rural India and thinking about the health sector there? You've done that sweaty walk? Okay, so in about 2006, I was working for a client, nonprofit drug development group, trying to figure out how could we introduce a new antidiarrheal drug into the market for children, diarrhea being #1 killer of kids under 5 in India. So we did a lot of what you might think of as the typical research. Talked to policymakers, held focus groups with mothers, visited various practitioners across the health spectrum. We met with mothers and learned that, gosh, they think, oh, everything I put into this kid is coming out the other end. I should just stop feeding him until he gets better, which is, of course, not what you would want someone to do. We visited the local informal practitioner, right, the quack in the local parlance. This guy had carried a stretcher for a couple of years at the tertiary hospital a couple of hours away, and then had come home to his village, hung a shingle, and proclaimed he was the local doctor. He didn't have aspirin. He didn't have oral rehydration therapy. He did have third-line anti-malarials, which was somewhat horrifying. We talked to pharmacists, frequently the first stop for a mother who is looking for something for her family, and learned about all the incentives that different companies give pharmacists to kind of push their product when a potential patient walks through the door. In all of this, I was left with, sort of on the one hand, thinking about the complexities of the science that still needed to be worked out in terms of this product. But on the other hand, thinking, that is the tip of the iceberg. The rest of these issues are not issues that our client can tackle by themselves. These are wraparound issues. These are the complex social issues and systemic issues that will thwart so many efforts that probably many of us have seen in practice. And for my client, they're funded by the Gates Foundation. They don't have to hit a certain return. They're kind of off the hook in terms of a lot of the commercial pressures. But for those of you in industry, that's not always the case. And so industry has to go into this with a very different type of orientation. And so we'll talk about shared value as an orientation that is hopefully helpful in thinking through that. I think of shared value as really a continuation of a long conversation that almost all of you undoubtedly have been part of over the last 15 years. This thinking about how society and corporations interact. Is it on the basis of kind of corporate philanthropy, and how do we do that really strategically? Is it on the basis of CSR and the responsibilities that our companies assign themselves? Is it on the basis of shared value and thinking about what might be an interaction between corporates and society that benefit both? I'll say that for the clients we work with, the most sophisticated know they need all three. There's not that one of these is better or more important than the other. From the corporate perspective, all three serve different purposes and need to be part of a cohesive portfolio. But I think the one thing that I think differentiates shared value and gets us excited about this complement to these other pieces is that we actually see the potential for change at scale. And keep that in mind. I'll share some examples. But to me, that's part of what is quite exciting about this being a bit different. It moves us from this sense of, that's not really a problem for us. How do we just kind of ignore it? To saying, we've got a problem somewhere in our operations, somewhere in our communities. Let's do something, make sure there's a press release and sort of get acknowledged for whatever we're doing. And then there's, I think even companies moving towards shared value have thought, this probably is a problem we ought to think about solving. Let's write some checks. Let's get some partners. Let's be part of a solution. Your shared value asks us to say, is it an opportunity? Is there an actual opportunity to think about building social issues into corporate strategy? I circled corporate strategy on my notes. This is not about kind of starting from the foundation or the CSR side of things. It's starting from the engine of corporate activities, the corporate strategic planning function. What is the opportunity to lower costs, to raise the top line, or to truly differentiate on the basis of impact? So that gets me excited. For those of you who are particularly visual, just a quick clarification, shared value is not sharing the value that has already been created by a company. It is about expanding the pie of value. For those of you who are not visual, we'll get to the definitions in just a minute, but I find this is sometimes helpful for folks in a big setting. We're all familiar with what sharing the value created looks like. It's some of the other pieces of the corporate social engagement portfolio, but we're going to talk more about the shared value piece today. So I mentioned the opportunity to have impact at scale. The scale of our problems is staggering, right? And we can think about shared value as being relevant to so many of these things. From a nutrition perspective, right? You have 35% of Americans facing obesity, while you've got 870 million people on the planet who don't have enough to eat. The lack of access to water, right, makes it impossible for rural farmers to grow the food that might satisfy the nutrition problem. That's true in California as well as Africa, as it turns out. Pollution and deforestation, right, what this is doing to our systems. 20% of the world's population living in poverty. Millions who can't get jobs because they can't access the skills they need to get those jobs. And so I think part of our challenge as we think about the relationship between corporations and society and all of the actors they engage with in that journey is to think about these issues and how we actually mobilize for scale. The reason I think this is logical is because if you look at the actual size of the different sectors we typically turn to, they're dramatically different, right? So the corporate sector, $20 trillion, right? The government sector, 3.1. Nonprofits, a little over 1. Foundations, less than 1. It's not a huge surprise, right? It's from the economic engines that you get tax revenue. It's from the economic engines of the private sector that you get philanthropic capital, right? So the relationship here matters because we can't just turn to the residual funds that are generated from corporate activity. We don't actually look at the engine. And that's part of why I think this has tremendous potential. So for the verbal folks in the audience, if you're interested in kind of quick definitions, shared value really comes down to the corporate policies and practices that enhance the competitiveness of a company while simultaneously advancing social and economic conditions in the communities in which it sells and operates. It is creating economic value by also creating societal value. It's using capitalism to address some of the social problems that I just spoke of. It's not this sharing of value already created. Importantly, it's not personal values. It warms our hearts that the term shared value is used so ubiquitously. I heard Pastor using it recently. I mean, it's not actually a values-based argument, although frequently the values of key decision makers would align with this. But we're not actually talking about kind of personal passion, of course, here. And it's also not about balancing stakeholder interests. Stakeholders are undoubtedly consulted and they have input, but unlike some of the philanthropic strategies I've seen or CSR approaches, it's not about kind of who's our squeaky wheel and what do we do about them. So it doesn't take that perspective. It would also suggest that maybe then all profit is not equal, right? Profit that involves shared value actually enables society to advance and for companies to grow faster. When Michael Porter gives this talk, he stands up here, he's got arms that are like 8 feet long, and he waves them, and he says, this is the next major transformation in capitalism. In management education, Harvard Business School is now doing a core class for all MBA students in shared value. A truly new way to think about how the private sector will advance. I think for some people, they say, oh, shared value, okay. We've kind of this Venn diagram of social issues and business opportunity, and there's some sort of overlapping piece in the middle. In fact, I would challenge you to think about it more as this virtuous cycle. So a company identifies some opportunities that create social impact, which then drives business impact, being very quantified, top line growth, revenue, or cost savings, or explicitly measured differentiation. And then they think, oh my gosh, well, that is so great. We better innovate and keep driving this, right? So then the company has an incentive to continue investing, to expand that work. And it creates more social impact, which drives even greater economic impact for the business. And they're encouraged again to make another round, right? This is kind of the cycle that we think is what allows us to get to the numbers we need when we think about the scale of the problems we face. So rather than thinking about that kind of static picture of the potential overlap of social and business issues, if you think of this as more of a cycle, a self-fulfilling and perpetuating cycle, it allows us to think of impact, I think, quite differently than we have in the past. So we're seeing this all over the place. Dow Chemicals pulled 600 million kilograms of trans fats out of our food systems. Nestle has created a bouillon cube that is infused with the right mix of micronutrients to suit different populations in the global south. Hundreds of millions of servings of appropriately fortified micronutrients reaching consumers there. IBM's investments in technology and innovation, more than 2,000 smarter cities thinking about power management, transportation more effectively. Safaricom and mobile banking, BD and the Uniject needle, safe medical devices, Intel and teachers. You know, the numbers are just kind of staggering. If we go back to those embedded circles, no one else in there can get to these kinds of numbers, arguably because they all would satisfy those shared value criteria. So where do you go to look for shared value? Many of you may be familiar with this. The original article came out in 2011. There have been subsequent articles. It's great to have a great framework in HBR, but in fact, it turns out you need to then go study the opportunities for shared value in each industry to get people to move. So we have done this in global health, looking at the pharmaceutical and med tech industries. Shared value in banking was released earlier this year. Shared value in extractives was released last week. For all of those, there's kind of three generic ways we think about companies creating shared value. I'll give you the sort of health version, just given what we're focused on today. But you're welcome to sort of look at it through any of those prisms. You know, the first really comes down to products. You know, how do companies think about R&D for different products, for different unmet health needs, and how those vary by population and by market? How can they adapt existing products to be more appropriate, maybe in terms of cost or complexity? How can they tailor products to meet local market conditions? So we'll talk more about each of these, but that's the first category. The second, in terms of value chain, how do you sort of reduce production costs, efficient local supply chains or manufacturing? How do you adapt the downstream pieces in terms of distribution, penetrating new markets, and better meeting patient needs? So this one has an upstream and a downstream component that we see in most industries. The third is the most complicated, and it's the one where I think collective impact is the most helpful. And this is really around the residual systemic challenges that companies face. So these are sort of, how do you enable a local cluster to evolve such that the social problem can actually be reconciled with the company's input? Is this about increasing demand for healthcare interventions? Is it about strengthening the healthcare system? Is it related to policy and the regulatory environment? So lots of different issues here where you can imagine it becomes very difficult for one company to kind of tackle any of those on their own. So I could go through examples for each of these, but I think what I'll do is focus on an example of a company doing all three of these in one place. That's Novo Nordisk in China. So you can see a little bit of this come to life. So first, just a couple points on diabetes in China. It turns out to be a huge market, 92 million diabetics, growing obviously with an aging population, about 70% undiagnosed, and only about 1 in 10 managing the disease effectively. The compound annual growth rate of the market between 2010 and 2015 was about 20%. So massive, exploding market. You know, Novo Nordisk was one of the first companies to enter the Chinese insulin market, actually in 1994. By 2010, their market share was about 63%, 13% higher than actually their global market share, and it's about $1 billion market. And as I said, growing rapidly. Their work there has saved an estimated 140,000 life years. in the work they've done. So I'll talk about each of the three levels here, but that gives you a snapshot of both the business impact and the social impact as a result of their work. So starting in terms of products, there's very explicit effort to think about the needs from an insulin perspective of the Chinese patient. So different research consortia, understanding these unique needs compared with the other populations that they serve so that the product could be tailored appropriately. From a value chain perspective, they were one of the first to open a local production facility. This is in 1995, allowed for very quick production efficiencies and to more rapidly respond to different changes in market demand. In 2002, they were the first company to actually open R&D facilities in China in this area, which gave them obviously advantageous access to some of the best Chinese scientists and the talent pool there. From the health cluster perspective, there was a long list of things they did. I'll focus on three. One was about improving the national treatment standards in partnership with the World Diabetes Foundation and, of course, the Chinese government, so that with new products in the market, physicians were trained appropriately and following the right protocols in terms of how to diagnose, treat, and then support patients over time. So physician training and adapting medical curriculum was another big part of that effort in thinking about their market long term. Third was really around high-profile awareness campaigns. And I think on many of these, we might say, gosh, pharma companies do that all the time in the United States, right? They go around telling doctors about their products, and we see all kinds of advertising. Obviously, the U.S. market is quite unique in many of those respects, and in a lot of countries, that's actually not allowed. So the way this was done was quite differentiated from their competition. So now with over 60% of the market share, they're growing at 40% a year, continuing to save hundreds of lives. The sense is that extending the good disease management that they have started to all of the urban areas in China could be worth as much as $37 billion to the Chinese economy, and approximately $30 billion for Novo itself. So a really interesting confluence here of the product adaptations, working with local R&D facilities to get the distribution and physicians to get the distribution right, and then dealing with many of these enabling factors in the places that they are working. So all three of these in one place. This success, if we think back to that kind of virtual cycle, has created a huge investment pool to think about how we apply this to Nigeria and India and Bangladesh, right? So this is where we suddenly see, wow, we're seeing the social value, it is driving economic value, and the company is incented then to invest more to figure out how to do this in another market. So it sounds so neat and clean, I know, when you hear some other company's example, and of course it never is. There are a lot of things that we see as enablers of shared value in different companies, but there's 5 worth mentioning for us probably here today. You know, one is, and this is like number 1 on every list of everything you ever might want to do in a company, but that sign off from leadership, either at the CEO level, perhaps at the country level or at the product business unit level, is of course essential, in part because this takes a lot of experimentation, and the hurdle rates around internal investment are likely not going to be met on the same kinds of timelines that you would expect other corporate investment cycles to follow. So there needs to be an acceptance of that, and not even just an acceptance, I'd say sort of an indulgence in that. Well, what does that mean? And it relates to the second, which is a real culture of innovation and learning. So rather than saying, oh, we missed our target, you know, slap on the wrist, you're terrible, what bad forecasters you are. The question is, we missed our target, but here are the 3 things we've learned about why this market is so different from the markets we use to set our targets, right? And this sort of reward for learning and the explicit investment in some of those feedback loops. You know, it's interesting for my clients who are kind of foundations or large NGOs, they always lament the fact that, gosh, you know, the private sector, they get data so fast on kind of what's working. And if only we had data, you know, we would be able to drive our own social change more quickly. So then the burden is on the private sector to use that data effectively, use that data to change their own practices, and we'll talk in a minute about changing the practices of others. But that executive level sponsorship and then acceptance and real excitement for learning and course correction is a big part of figuring this out. The approaches to measurement, I think, are likewise mostly confounding to everybody, because here we face the challenge of how hard it is to measure social change in the first place, which so many of you I know have spent, whole careers thinking about. But how do we connect that to the business impact? So the impact, the implications of measurement are very, very profound here, right? Because if you want that virtuous cycle to work, you have to have the metrics and data that show the connection between these things. And that is not easy. We think a lot about that and have recently done work with a whole set of pharma companies on how to do this more explicitly in that industry. But it is not obvious. And I'd say there's not a well-trod road for figuring this out. But it's an investment that's needed in order to ever get the cycle working in the first place. I think there's a need for a whole different, probably set of skills when it comes to thinking about unmet patient needs and unmet health needs. I think gone are the days we're sort of entering a new market as some turnkey process in a lot of industries. And instead, there needs to be this constant ability to sense what is changing and where the company might be well positioned to act. Many would say, gosh, companies are perfect for that, right? They're always looking at different market opportunities. And I would agree. In some of these markets, though, something could land on their nose and they may not know because they've never operated in these contexts. And so I think this does still challenge industry in many respects. And the fifth point, very apropos to today and tomorrow for all of you, is this question of partnerships and how to get this work done. Because many of you could be sitting here thinking, look, I'm a company and I've got these things I need to get done, and I don't know how to do all those other things. I don't know how to change Indian practice around viral disease treatment, and I don't know how to change medical education around whatever. So that's right, it's complicated. And the new partnerships we see developing are quite interesting. We'll close with a page of kind of strange bedfellows, right? But there is a need here, and some of the biggest international NGOs want to be partners on this basis, on the basis of commercial objectives with industry. So you can look at some of the work of Mercy Corps, of CARE. Some of these organizations pay PSIs as well. Some of these guys are thinking much more, not about being grantees, not about sort of satisfying reporting requirements, but actually being part of a supply chain and being held to commercial expectations in terms of what being the delivery arm for an organization might look like. Very different orientation. And I'd say it's challenging all around. The NGOs kind of scratch their heads and say, gosh, am I compromising my values to be, affiliated with a company? And, they can go to see if they can fall asleep at night. But yes, one might argue there's tremendous opportunity here to achieve their goals, right, by engaging in industry. Likewise, industry has to recognize and appreciate and respect many of the skills that the INGOs, international NGOs, might bring to a partnership, right? They actually have local knowledge in a new market that a company may want to enter. Relationships with policymakers, they're very hard to forge, but could be very important to some of those contextual elements. So these partnerships, again, we'll talk about collective impact as a framework for organizing those partnerships, but I do think they challenge conventional wisdom in a number of ways, both for the companies and for the partners. So that was fast. That was sort of very quick shared value. I guess I'm assuming you've all read like 4 shared value articles to actually take all that in, but let's assume you have, and assume you're now saying, but wait a minute, how can my one company, even working with that giant circle full of resources and all our smarts and inventiveness, how can we, with the power of the markets, actually tackle any of these serious problems we face? What about government? What about civil society, right? Aren't there responsibilities all around here? And this is where we kind of shift gears from kind of what companies might think about to how they might implement. So once you've, as a company, sort of evaluated different shared value opportunities, whether they sit in the product dimension, whether they sit in the value chain dimension, or whether they sit in that kind of enabling context, I promise every single time this question is still probably going to come up. And it's a question worth asking because, of course, the answer is yes, everyone has a responsibility, but those roles and responsibilities will vary. And public-private partnerships are not new. However, because of the complexity of the problems we face, I think actually our paradigm for thinking about problem solving is a bit off, right? So many times we think about social issues as kind of baking a cake. There's a recipe, you do it again and again. We did a pilot, it's great. Why don't you fund it? We'll do it in 100 places. This assumption that something is about getting the right ingredients in the right proportion in the oven for the right amount of time gives you the same output. None of the problems we've talked about so far would fit that, that paradigm. There are definitely more complicated problems. I cannot put a man on the moon, and apparently the private sector can't either, but someone can, right? I mean, people in NASA can do this. So this is hard, but people with the right expertise can make this happen, and in fact can make it happen on a repeatable, predictable basis. I would argue, though, that the problems we're talking about are not this either. The parallel I would use here is the paradigm of raising a child, right? This is complex. I have a 3-year-old and a 5-year-old, and many of you probably know far more than I do how complex this is. But I can tell you, and you've experienced it, right? Every time, every child is different. Every year, every week, every day, their needs change. And every family will kind of interpret those needs differently. I got a whole shelf of books about how to make them eat and sleep and listen and love learning and love reading, right? But I interpret those very differently than any of you might for your families and your children. And, much to my chagrin, the influences on those children are impossible to control. So no matter how much we might want to think about protecting them from media or from some bully or from the new teacher, or we want to steer them towards a specific set of friends, right? These influences are beyond our control. And this calls for a very different approach for success, right? And I think too often the social sector thinks about our social problems as more kind of simple or complicated problems, as opposed to recognizing the degree of complexity that sits within them. I think this is what kind of sets up a lot of tension in the partnership structures that we've seen in the past. There's this hope that somewhere down their line, there's going to be some sense of predictability and repeatability. And in fact, I think we've mostly all been disappointed when that has not been true, and we face the problem that we do. So I think with complex problems, it really is what drives us to think about a different approach. And that's what's made us think at FSG a little bit more about a new paradigm for a partnership called collective impact. So again, for the verbal folks in the room, collective impact is the commitment of a group of important actors from different sectors to a common agenda for solving a specific social problem. Probably my favorite part that's underlined here is specific social problem. Complex problems, of course, have like systems nested within systems, and then they have systems that sit adjacent to them. And when we work with groups pursuing collective impact strategies, the first big problem to resolve is sort of like, where do you draw the boundaries around the problem we want to solve? Because of that complexity, it can be very difficult to kind of untangle and isolate in a not artificial way the problem that may need to be solved. I'll use more than just health examples for the collective impact section here, but one great example is I worked with a team on reforming the New York juvenile justice system. That's complex. Between state-based systems, municipal systems, the judiciary, the police systems, the educational systems, the substance abuse systems, the mental health systems, the education systems, right? All of these actually touch any child who goes through that system. So the first thing we had to agree on was what, in fact, is the New York juvenile justice system? How do we want to define that for the purposes of reform? So the idea here is that what if you had all the organizations, all the actors that matter to a certain issue, how do you have them working towards the same goal, measuring the same things, and actually aligning across the sectors? And then how do you have each of those sectors actually seeing each other as real partners in the effort and respecting the unique contributions of each such that they're coordinated and they're willing to share the lessons they're learning along the way? Our original collective impact article, we featured a group called Strive that was doing this kind of coordination in Cincinnati across the education system. And there's a great example where you've got organizations that do teacher training, and you've got ones that do technology in the schools, and you've got others that do after-school programs. And how do you actually line all these up against the educational outcomes that are expected within that system? And the result of lining them up actually around a core set of goals and shared lessons learned was that some groups got out of the business that they weren't very well suited for and were able to really focus on what they did especially well. So there's kind of 5 pieces that we see in collective impact when this is working well. The first is this common agenda. I'll admit I don't love the phrasing common agenda. To be more specific, what we mean here is really a shared understanding of a problem, a shared vision for the success of the effort, and then a shared strategy for achieving change. Another quick anecdote, the New York juvenile justice example, you had people from the police and related agencies who said, oh yeah, well the purpose of the juvenile justice system is public safety. And then you had people from the child advocacy community who said, well the purpose of the juvenile justice system is to give these kids the supports they don't have in their communities, so they stop making these stupid decisions to like jump this turnstile in the subway, right? And completely different perspectives of why the system even exists. So agreeing on that, and then thinking about what success looks like, and then coming to a shared perspective about what needs to happen is really this first big piece. Shared measurement then becomes critical. Can you get groups to agree to measure the same things? In juvenile justice, could we get all the nonprofit organizations that the New York City outsources services from to agree to measure their success on a common framework so that the judges in the family court had some clue about where they were sending the children and which kids would do better in which types of facilities? This is, data is dangerous. This is not an easy one. But it's an essential one when we can get folks aligned around shared measurement, because then you get shared accountability and everyone can focus on improving their work. The mutually reinforcing activities, a little bit more straightforward. I sort of alluded to this. How do you line up all the types of activities you need across a system to all be pulling towards that common goal? Make sure there are no gaps, limit the redundancies where appropriate, so that they're really coordinated around a joint plan. The idea of communication, to me, communication is kind of the lubrication in the system. These are not organizations who are used to working together, but the communication is part of what builds the trust that enables any of these complicated collaborations to succeed. So this has to be managed very deliberately, both internally in terms of the actors, but many times externally as well, in terms of shared external stakeholders to any effort. And lastly, and this is always my pitch to funders, this has to be somebody's job. There needs to be a backbone organization that is actually funded with the right skills in data gathering and facilitation and meeting management and communications to make sure the trains run on time and the impact is achieved. We've all been part of efforts where someone raises their hand to plan the first meeting. Maybe at the end of that meeting, one more person will raise their hand to plan the next meeting. And after that, no hands go up and then people stop coming, right? No one has time to do this off the sides of their desks. So being sure that there's an explicit role with the right skills of a neutral organization to help move a group forward, we find to be essential. In the health area, I was one of the authors on a paper we released earlier this year on what this looks like in some of the multi-tiered global health partnerships, global development partnerships, where you have that kind of global secretariat, you have perhaps regional, but certainly country level coordination going on. How can you think about the responsibilities of a backbone organization in each of those scenarios? So for anyone who's interested. So I'll give you, one example here, and this is Mars, the candy company, and the collective impact effort that they were a part of and really an initiator of in Cote d'Ivoire. So the decline of cocoa yields from Cote d'Ivoire, major challenge for a candy company. About 70% of the world's cocoa comes from West Africa, and Cote d'Ivoire is the largest market there. But essentially, the limitations in terms of yield per farmer were dropping. Limited farmer training, combination of factors, which then leads to limited yields, limited income coming in, limited reinvestment in the crop stock and fertilizers, the decline then in soil fertilization, and imagine, right, this downward spiral and what it means for companies that depend on those crops. So Mars sort of, worked with a range of actors. The list here is a subset really of those ultimately involved to think about, well, how do we tackle this? How do we tackle the science that's needed in terms of improving the crop stocks? And they have agronomists internal to Mars that they could bring to that effort. How do you bring technical assistance to the farmer communities in terms of improved fertilization and farming techniques? How do you bring improved services then to the families? And how do you improve the overall production and then the purchasing systems that enable those farmers to get everything to market? So the strategy started with creating what they called cocoa development centers, 75 of these around the region within Cote d'Ivoire, to really provide a lot of the technical assistance, capacity building, and scientific expertise that was needed at all of the different levels. So working with TechnoServe, working with the Gates Foundation, working with the World Bank on financing, working with the government of Cote d'Ivoire to stop that pesky civil war, right? I mean, sort of all these things that have conflated to really make life impossible for the cocoa farmers, and then, you know, carrying on to affect industry. So a fascinating example, we get a lot of questions about, well, you know, how do you start a collective impact effort? Is it okay for a funder to start one, or for a corporation? Is that kind of the right role to play? And we've seen it happen many different ways. There are times when a foundation or a group of funders are able to come together and fund a kind of facilitated process that leads a group of stakeholders through the design and development of a collective impact effort. There are other times when folks from within the system step forward. I'll say juvenile justice was initiated from 2 women in Albany who saw the opportunity when Governor Cuomo was going to come into office to get a new vision for juvenile justice on the man's desk January 1st. And so there was huge momentum from inside that system to push reform. They were very quickly able to reach out to private funders to get the funding for the facilitated process. But the initiation in that case, you know, really coming from within the system. So corporations, again, I think sometimes hesitate. On the one hand, many will say, oh, I don't think corporations are really cut out for this. It's so messy. Can they wait? Will they have the patience? Can they respect kind of these complementary assets? And you know, I think a cynic might say, no, they could never do that. They're terrible partners. But in truth, right, for all of the kind of lamenting about the quarterly earnings cycle, we see companies making long-term investments all the time in new markets. R&D is a long-term bet, right? So we know that companies have certainly in many instances demonstrated willingness and enthusiasm for committing to things over time. But I do think that there are shifts, you know, really for everyone involved. And here's the Bedfellows picture. You know, really, like, so business sort of represents, we've got, you know, CEOs that steward corporate resources. You might have a supply chain manager who's involved in a shared value effort that bumps into a community issue that is part of a collective impact effort. You may have government leaders who are really thinking more at that cluster level, who may be actually able to provide financing, tax incentives for some of the change that may be needed around a collective effort. And then you've got NGO leaders who may be sort of related to implementers out in the field. And so this conglomeration, you know, has to really begin to move in concert. And I love the picture because it really does imply many new actors engaging in very different ways, which of course you'll talk more about in the next couple of today and tomorrow. So I'll close with just a few of the big mindset shifts that we see for this work to succeed. And the first goes back to the picture of the cake, the rocket ship, and the child, really moving from this sense that it's a technical problem. All we need is better technologies. And poof, right, that problem goes away. To really thinking in a much more adaptive way, a way that takes in information on a regular basis, makes meaning of it, and reacts. The feedback loops that are needed for that, I think the humility in many senses that's needed for that, and the openness and the lack of fear associated with course correcting along the way. Ron Heifetz has a great image that he uses in adaptive leadership, right? Where you have to be able to move from the dance floor to the balcony. Right? How do we teach managers, you know, in all of these sectors when they're working together to go from the really deep information related to their core piece up to the balcony where they can see the entire dance unfolding? I think there is a mindset shift all around that needs to probably evolve from kind of thinking in terms of projects. Oh, it'll be a one-year project. It'll have a 3-year timeline, you know, to really thinking about what it's going to take. You know, we're in it maybe 5 years and maybe 10 years. But if we've done the math right, we know what the market potential is. So we're we're in it. And likewise, that brings confidence to partners to commit and build the infrastructure that might be needed if they're working in a collective way to help move things forward. I think operating in the risk-averse culture to really operating in an entrepreneurial culture is new and important, not just for folks who may feel like a small piece of a big company, where entrepreneurism is not necessarily the de rigueur, but it's just as true in the nonprofit space, right? This sort of risk aversion is profound there. And this stuff is really hard. So I think risk aversion is not for the faint-hearted, but being able to embrace that and live in that more entrepreneurial spirit goes a long way. And last, is really thinking about the role of competitors. So collective impact, we get a lot of questions about this. Well, we're working to build the health system? That's gonna be good for our competitors? Well, yeah, maybe. But a lot of these issues we would put in the category of pre-competitive issues. You don't compete on the basis of how good the health system is. You compete on the, the strength of your product, your differentiation, your relationships with key stakeholders, right? Those are the things you compete on. So we see a lot of opportunity for said competitors to actually partner in more of a collective effort, as we see in the cocoa example, on issues that are really more contextual in nature and very far away from the basis on which most companies tend to compete. So there you have it. Shared value and collective impact, 40 minutes, 35 minutes. We've got a few minutes, though, for questions, and I want to make sure I'd love to hear your reactions, questions, observations, experiences for which any of this rings true for you.
Yeah, if you have a question, we have about 10 minutes. You could introduce yourself, and then I think use the microphone so that we can get the recording, if you would. Thanks.
Laura, may I take the prerogative as co-chair of this to ask you a question? And as always, very inspiring and stimulating. Thank you very much. You talked on several of your slides about unmet need, unmet medical need. And there is a nuance, however, with need and want, an unmet want. And I often feel that need suggests that we know what other people are missing, rather than what it is they want. And I wonder if there is any way of enhancing shared value by really asking people what it is they want, and if you can build that into the equation.
Yeah, I think it's a great point. And because shared value would start from the corporate strategy point of view, customer needs and wants is part of any strategic planning process. So there's an implication there that it's not about just kind of force-fitting your product into a new market. Therein lies, I think, part of the opportunity in the product category to differentiate in a way that is most desired by the patient population. So I think it's a great point, especially especially in that product category of shared value efforts, to be quite sensitive to that. I think it also does represent the opportunity for different kinds of partnerships. IMS is not going to give you that data in India, right? There's a whole new world of partners who are much closer to the patients than, frankly, any multinational is likely to get from the US or from Europe or even from an Asian office. So I think it does also have implications for the partners through whom you learn about the wants of that patient group. It's a great point. Great point. Please.
Laura, I really enjoyed your presentation. I want to take up on what Jack just said.
Yeah.
I think what's missing in this conversation are actually the community and the people who's going to receive the benefit of public-private partnership. Yesterday, I participated at the American Public Health Association conversation. It was a public-private partnership conversation because IOM and Public Good Projects doing this whole thing of Healthy America, and GE and BMS were there, and because GE and Healthy Imagination has tremendous impact. And yet the question from the audience was that element of kind of Jack's question, you're doing it for yourself or you're doing it for us? And that trust and the importance of understanding that at the end of the day, you're actually not only creating this partnership in order to enhance competition, future, and also your core value, but it's actually the people that we are going to try to serve. And so the issue has to be, in my opinion, maybe a better balanced conversation about Jack's point. What about the people who are actually, those who's going to benefit? How do they become part of the public-private partnership? How do they engage in the conversation? And they can actually shape, in fact, many of these directions.
Yeah, and I think it's critical, and especially, a big part of collective impact efforts have and I didn't go into it, but a huge community engagement piece, because especially collective impact efforts tend to be very place-based. So you can draw a circle around all the people that matter and those specific patients that may be a part of that. So in collective impact, there are frequently mechanisms for that. I do think, though, from shared value perspective, there's an authenticity point here that's worth mentioning. Some companies sort of say, oh, well, we make drugs, they make people healthy, we're a shared value company. Well, not really. I mean, there's an intentionality behind measuring the relationship between the improvement in health, the improvement, that social impact, and the business. And if that link is not measured and tracked efficiently, then it's really, you're missing the intentionality. It's sort of convenient that your products aren't, doing harm. But it's not enough to have products that don't do harm or that conveniently will be good for some people. I think when we see shared value executed at its most successful, the authenticity is there throughout the business cycle, whether it's from the R&D side or the business strategy side or investment side or stakeholder engagement and feedback from patient side. You see it kind of throughout. And I think it's a big piece that actually confuses folks who want to
I'm
say
pushing a little harder to say engagement of the community in the design and implementation, so that it's really part of their initiative as well, not just from a very, high-level public-private activity. I mean, at the end of the day, I think that's the trust issue is going to be very, very important.
Yes, it's one of the biggest issues, I think, when we see the collective impact efforts undertaken. A big dimension of the trust also sits in kind of the backbone organization, ends up being a bit of the de facto border, or the gatekeeper is not a very nice word, but sort of they're kind of the front representative of a collaborative. And there are a lot of risks, depending on which organization plays that role. There may be perceptions that the organization who has stepped forward to do that is just looking for more overhead money to run this program next to all the other things they do. Or that the leader of that organization is not authentic in wanting a full shared success across the partners involved. So the selection of the backbone organization and its perception among the community is a huge part of making sure that that community engagement actually feeds up in a productive way to the overall design.
Louise Grisham?
Yes, I have a
Sorry,
comment.
sorry, Sir George. I had Louise first and then Sir George. Is that all right? Okay.
Louise.
Thank you, Laura. Very eloquent as usual. Really appreciate the work that is behind this and you fielding tough questions, which I hope this one isn't too severe. In the sense that as we're trying to come up with collective agendas and really be authentic, why does it seem that the corporate sector gets to cherry pick topics of interest and leave the public side to put aside the free market principles and also to be the drivers of innovation? So when Dr. Zhao and Jack, realistically talk about getting people involved, even though people hear what is wanted, that may not be able to translate. So how honest can we be about this cherry picking on big social issues and products versus just having an honest discussion to say, public sector, you will do this. So let's figure out a way for you to do it the best you can and somehow make it sustainable.
Yeah, this is a great point because shared value doesn't solve all our problems. I mean, just to writ large, right? There is a portion of the population for whom, no matter what the price of that billion cube is, they don't even have a pot to put it in, right? So we cannot expect that simply innovating and going down market generically will solve all of our needs. And I think part of why shared value has been received as it has been, which has been quite favorable, In a way, it meets business where they are. A lot of the businesses are kind of confounded by how to tap into these massively growing markets, and they know they need to, and they've been promising shareholders forever that that's where all their growth is going to come from, and yet they haven't actually always done so much about that. So there's increasing pressure for them. I think the capitalistic nature that is the engine behind this is going to lead in some of that. I think corporations will make those decisions based on where they do have a competitive advantage, and it won't be everywhere. And this is why I think that corporate portfolio can't be just shared value. It has to also be CSR. It has to also be corporate philanthropy. We need all of those working together because shared value really does, start and end, and I think appeal to corporations because of that sense of responsibility they have in terms of shareholder value. I think it's not something to apologize for. I think, in fact, companies should stand loud and proud about the sustainability of their efforts when it's driven by their markets, right? Because then we get this scale we've been looking for. Then we get Novo Nordisk, with hundreds of thousands of patient lives, which the World Diabetes Foundation could never bring us. So I think it's a critical point, and it's a good one to bring us back to that portfolio really does need to work in concert with so many others in order to fill the full range of needs out there.
Okay, Sir Georgeline.
Yes, thanks very much. I have 3 points. One is a comment, is a question. Second, a comment. The other is a difference of opinion. The first one, the comment is, yours was a marvelous presentation. I've heard Michael Porter twice. I think you're probably better than he is. But after him,
someone should tweet that, whoever's tweeting.
After him, the first time, I had a discussion with one of the CEOs of Unilever. And the point he made to me, shared value will not work unless it's a good economic value proposition. One of the things I did not hear you mention is that critical element. It has to be a good economic value proposition for shared value to really work. And I'd be interested to hear how you factor that in.
Yes.
The second one, in terms of impact, collective impact, I would suggest that you alter your definition. The collective impact is the outcome. It's what happens. It is not this. It's the outcome. So it's the outcome. And the difference is this. Baking a cake is not simple. When I try to do what my wife does, it never comes out the same way.
No comment on your culinary skills, but absolutely point taken. In fact, when we write about collective impact, of course, collective impact is the result. So they're always kind of collective impact efforts or initiatives, right? So it's a very important point. I would be remiss if I wasn't crystal clear on the economic proposition that a shared value effort needs to clear. It has to be this. It has to be so much business impact. And by business impact, I do mean revenue growth, cost cutting, or measurable differentiation, right? I think some of the best companies in the world have very sophisticated ways to think about differentiation in measurable, very strict, quantifiable ways. And so this is, if that didn't land, then note. This is very much an economic argument internally. The only slight caveat to that is that it's an economic argument that may not materialize in the same time frame as other investments the company could make. So this is part of the big challenge we have. We look at shared value opportunities for a company, and they are going to be weighed against other investments of corporate capital or debt, right? So it gets taken on. And they have to pass these investment hurdle rates. And this one may take longer, and it's going to be harder. So it's discounted a bit, right? So that return may come over a longer period of time. But again, if the numbers have been done right, the opportunity in an insulin market in China, it's going to pay off. But it's a bit of a different calculation than your typical business investment. If that helps. Yes, Leslie.
You had your hand up before I completely.
That was a little sneaky. Thank you, Joe. Laura, thanks. This really was a very thought-provoking presentation, and I was particularly intrigued by the idea of all profits not being equal. I wonder if you could expand on that a little bit and maybe reflect on how you've heard leaders of companies actually talk about that, or if you've seen it actually put into practice in terms of profit analysis or measurement.
Yes. If only the investment community would measure our profit differently, right? So profit on the back of environmental degradation is not nearly as appealing as the profit that comes from introducing new medical products, to a patient population in India that's never had them, right? And decreasing the burden of disease there. So that reference is really about the derivative impact of the earning of that profit. And those are kind of two extreme examples, but those are maybe in the most stark way, the way to think about that, the value of profit. Profit that's generating a social impact at the same time being the kind of profit we all want, and the profit that's destroying our planet and taking advantage of vulnerable populations, being the profit that's less appealing. There is a paper coming out, Michael and Mark have been working on it, for the investment community that I think will challenge some of the way investors assign value to different kinds of profit. So I hate to say stay tuned, but stay tuned.
Thank you very much.
Thanks,
Appreciate it
Sharon.
very much. Yes, excellent.